As of this afternoon, 1,423 Albertans have tested positive for COVID-19. Currently, 44 are hospitalized, 16 are in intensive care, and now we've had 29 fatalities. It is encouraging to note that while the number of identified cases grew by 50 over the last 24 hours, the number of recovered cases increased by 72 to 519 here in Alberta.
But the most important factor in how big or small the impact of COVID-19 is in this province is the behaviour of each and every one of us. This cannot be stressed enough. If Albertans stop following public health restrictions and guidelines, we can expect to experience a higher impact than the data currently suggests. If Albertans strictly follow all public health guidance, we collectively can further reduce the impact from what the modelling is currently predicting. Remember that the modelling is giving us the total number of anticipated infections in the whole population, not just the confirmed cases. That makes the numbers higher than what we have seen in other countries who are reporting their confirmed cases. It is also based on an assumption that every COVID case spreads infection to one or two other people. We can collectively reduce that. Changing our total infections in the province is in our hands. Every action makes a difference. We know that Calgary has had a higher percent positive rate in their lab testing, and this has persisted even with the change in our testing this last week. In order to get as much information as possible to reduce spread in that area, we are expanding testing effective immediately to include all residents of the Calgary zone who have a cough, fever, runny nose, sore throat, or shortness of breath. We are also opening testing to essential service workers across the province with any of the same symptoms I just mentioned, and we are defining that as anyone whose work site has not been closed to public access by public health orders, and who, if they were well, would currently be working outside the home. I want to emphasize we continue to expect anyone who is ill to remain home for at least 10 days from the start of their symptoms or until symptoms resolve, whichever is longer. What we've seen with other new viruses, so if we think about 2009, which wasn't that long ago, we had a wave in the spring and we had another wave in the fall. And the wave in the fall was bigger than the one in the spring. However, our response to the pandemic in 2009 was nowhere near what we've done for this particular virus. And that's appropriate because it did not cause the same kinds of severe outcomes that we're seeing with COVID. So what I would say is that if what we did was stopped all of our public health measures, let go of all of our testing and control measures, we probably would see a second wave. But I think that the path that's being articulated is to say our public health measures are buying us time to build up our testing capacity, to get closer to having effective treatments that are proven by research. We won't have a vaccine by the fall, but the longer we can keep the spread in our population from growing, the closer we get to some of those therapies that we see down the road. And so the plan would be to have that aggressive testing, contact tracing, some of the measures that have been discussed, such as considering the use of masks in public, regular hand hygiene, a lot of those preventive measures, even trying to stay 2 meters apart when out in public, some of those things may continue even after we lift some of the business restrictions and the other societal restrictions that we have in place right now. So it will be a balance in order to prevent that second wave. I don't think we can go back entirely to the way things were 3 months ago, but neither do we need to stay fully locked down for months on end to prevent that second wave.